95.9 FM WATD, the South Shore's Morning News. Rob and Beth. And it's that time of the week we check in with Dr. John Hayes. For a better experience at the doctor's office, try Dr. John Hayes' new highly personalized and affordable direct primary care practice. Find out more at drjohnhayesjr.com, drjohnhayesjr.com. Dr. John Hayes, good morning.
Hey, Rob, good morning. Good morning, Beth.
How are you?
I'm doing great, guys. Glad to be back.
Yay,
Glad
us
to
too.
have you back. I know. And we're going to pick up a topic we just started last week, and this is going to be a multi-part segment because you got a lot of feedback, people saying, more about, direct primary care. What's it all about? What exactly do you do? How does it work?
Yeah, so first of all, I want to thank everybody who listened in last week and then comments. A lot of feedback last week, even from some physicians, which was great. Yeah, just talking about how we covered, the depth
from
of
your peers.
Yeah, from the depth of healthcare that we talked about, the history of healthcare, what's happened and what's gone on, and so on and so forth. So we spoke about direct primary care working kind of outside the system. So what I thought we'd do today is kind of pick up about reduced administrative burden.
Okay.
And I'm going to start off with a comment that may or may not be comfortable for some people, but I'm extremely disappointed about what's gone on in the White House this week already with corporate involvement in healthcare. This is a nightmare. It's a potential nightmare. You've got one of the world's largest experts on AI, supposedly, from Oracle, now pitching with the president behind him the changes in healthcare that they want. This is not what we need, and I know it's just the tip of it, but physicians today and yesterday are outraged, and hopefully we're going to see a much, much better direction. But that was not a real comfortable pitch for a lot of physicians and a lot of Americans.
Okay, I actually have not heard anything about this. I mean, I heard about the Medicare, Medicaid, drug cost, executive order. But what is this?
Well, so basically pushing...
what would happen?
Pushing AI as part of healthcare and now pushing mRNA into cancer research, cancer therapy, and so on, which is... It's just a nasty, nasty bucket considering everything we've seen in the last 4 years. So as I commented online, and many, many physicians have, whoa, brakes. We need to – you cannot do this simultaneously. We would need to revisit exactly what has happened in the last 4 years. There's thousands of brilliant physicians around the world that are outraged with what we've seen. So it's time to put the brakes on all that stuff and really investigate what the hell happened in the last 4 years before we move forward into that type of scenario. And this just comes back to our point that we talked about last week. Physicians aren't heading up healthcare anymore. It's corporate stuff.
Okay.
And that leads us to where we are today.
No, I totally
agree on
healthcare. Yeah, for sure.
And so this is the biggest difference between what I do in direct primary care and what corporate-driven practices are. And if you are a physician and you work for a corporation, listen, the corporation is there to make money, private equity, whatever. And again, not to malign any physicians, not to malign any groups or hospitals. I get it. The world is drastically different. I get it. However, the problem is that when physicians aren't making the decisions, a lot of what is done is not necessarily always in the patient benefit, which is very scary. And then just a couple other comments, because I think it's important. And last week I've had a couple people say, you saved my life, you saved my life, you saved my life. I've heard like 3 times in the last week. My practice has only been here like 16 months. And I'm thinking back, well, what the hell did I do different? I mean, it's really not that I'm a better doctor than anybody. It's just that in direct primary care, I've got extra time because I choose who comes in and who doesn't. And I limit what needs to be done. And I also can do a really, really deep dive into patient records. And I say, it looks like your previous PCP talked about this, but it was never pursued. Do you remember that? No. And, so this is where a lot of the stuff that we are able to do to help people actually comes from, is having the time and the desire actually to dive deeper into patients because our patient panel is so much smaller.
And really do the art of medicine. So just to bring it back, just to kind of explain things to somebody who might not know anything. So Oracle wants to bring more AI into healthcare so that it takes a little bit of the expertise out of the doctor and having AI make more decisions.
Well, that wasn't specifically stated. However, yes, there are corporations that are pitching that. There are, even physicians' business groups that are pitching that too. Now, look, AI is a tool, but But you can use it like I use any other tool in medicine, calculations and research pulling, but you have to fact check it. Say, not to use that term, but you've got to do your own research and check multiple sources, including reliable medical sources.
Absolutely.
It's a tool. Yeah, that's the whole thing. It's just another tool.
I mean, you have, an X-ray machine.
Well, yeah.
You got it's a machine that you can use that maybe can help and can save time for you, but it needs to be managed by a human.
Well, so listen, it's called artificial intelligence for a reason.
Yeah.
We need to remind ourselves of that.
Yeah.
So the doctors are mainly concerned that they're not going to be able to treat their patients as much as they are used to?
Well, this is a concern that popped up amongst I don't want to go down that whole rabbit hole, but it's a concern.
Yeah.
It's a concern. It's not how we thought the year was going to start out.
Wow.
So, in any
Fair.
event.
All right. So administrative burden, he's got reduced administrative burden to spend. And we talked about the real thing is, again, more time and flexibility.
Yeah, exactly. And so by the same token, because we have time and flexibility, we can do... I can do more myself as a physician. I mean, sometimes if I have to place an order for a patient, a specialty referral, even call the hospital, sometimes the staff is like, what? I'm speaking to a doctor? What the hell is that all about?
Oh, my God,
it
that's
doesn't
so
happen
funny.
that much. And it's pretty cool. It's cool because they're not used to it so much. That's great.
I know that says a lot, though.
Well, we're so fortunate. We have some really, really wonderful hospitals and physicians in this area. We just do.
Good.
And people are, and physicians are, and the staff are interested in working together to just improve health care.
I do feel there are a lot of good people definitely in this industry that are around here, that have trained here, that live here, that work here.
Exactly.
Agreed. Yeah, no brain drain.
Exactly.
Yeah, the best hospitals in the world are
really passionate
in Massachusetts.
about care.
Right. Yeah. But, so the thing with my position in direct primary care is I have more time as the physician to coordinate care. Not that other practices don't do it, but it can take time. One of the issues that we saw this past week is I had a woman who came in with some abdominal issues. She had some imaging done. The imaging was done over 2 weeks ago. She was sitting on pins and needles waiting to get a result. She called their physician's office. Oh, we can't give you anything until the physician calls you. But it's been 2 weeks. When am I going to call? Oh, I don't know. I'll let her know you called.
Oh, man.
So this stuff gets people are sitting on pins and needles sometimes.
Nobody wants to feel like they're deprioritized, especially regarding their health.
Right, exactly. And that, unfortunately, it's happening.
Yeah.
And that's what, irritates people a lot. So
it would irritate me.
Yeah, exactly.
All right, so coordination of care. Fill us in on that one.
Yeah, so we do it all the time. If I need to make multiple specialty referrals, I had a wonderful new patient yesterday afternoon, has a lot of health issues, and I was able to, I said, I'm really busy tomorrow and the next week, but if you're available today, I happen to have some extra time, so you want to come in. And we did. So we accomplished multiple things. By the time the day was over, we made referrals to other specialists that needed to be done. And, if I wasn't in direct primary care, there's no way in heck that would have happened.
Wow.
Yeah.
Okay.
So, that's what I enjoy being able to do for people.
No, I can tell, and I really appreciate you.
Thanks.
Yeah.
So, that's one of the big benefits of what we do. And then, the next point, Rob, as you see, is extended appointment times.
Extended appointment times.
So we can establish extended appointment times. Because we can. I'm not working for corporations that says, okay, one complaint in 15 minutes. That's all you have today. One complaint with this patient, and if you don't see 35 patients today, you're not carrying your load or whatever it comes down to. I don't have any of that stuff at all.
Yeah.
So
you get to spend time with people.
Right. Exactly.
You can go into overtime.
Well, yeah, we can go into overtime. And then the next thing, which I think is really important to cover.
Oh, yeah, this is very big. Explain that. No insurance hassles.
Right.
Because I think we have a listener that just texted the question about insurance.
Yeah, so let's talk about this. This is really, really huge. So direct primary care is not concierge care, but it's concierge level care, meaning you're getting all the prioritization that we've spoken about forever, on WATD. But more than that, if you take a look at what you actually have spent in the last year, people call up and say, oh, my God, over 45, it'll cost me like $2,400 for a year to have a doctor.
Right.
I'm not doing that. I have insurance. Then I've had people call up and says, it's only $2,400 a year for me to have you? My God, I had really good health insurance last year. I had to go to the emergency room. I had to go to urgent care. I had to do this. I had to do that. It wasn't covered.
You have to fill a deductible.
Well, exactly. And then it's like, so this is what it's about. It's a choice. It's a choice. And we work with people the best we possibly can to help as many as possible.
Al's question, and this is Al. I assume it's not AI. I'm assuming it's Al. Al says, can you ask Dr. Hayes what health insurance does he accept? So, again, you don't do health insurance.
We don't accept or process any insurance. However, a couple important points.
Yeah.
I'm an ordering physician for Medicare. and I'm an ordering physician for Medicaid. So if you need to have diagnostic tests done, referrals done, laboratory tests done, we order those. Unless it's a very, very tight HMO, which are very rare anymore, those services are usually paid for by insurance.
Great.
Okay.
So, but again, it's sometimes, we've talked about this before, it's cheaper for the patient to not use their insurance to go out of pocket.
Right.
Yeah,
Very
I know.
times. And the other thing, Al, that's a great question, but the other thing to realize is that HSA and FSA programs and even employer programs oftentimes will pay for direct primary care. And more that's happening. You know, companies are now choosing to have direct primary care physicians as the base physicians, if you will, taking care of their employees, and meanwhile they carry a higher deductible plan because the services are, you know, in general, a whole lot less expensive for
You're
them.
right. That's smart for a company to kind of pool together resources.
Right, exactly.
And funnel it into like one area and then be able to allocate for others.
Exactly. Yeah. So there's a big push in that regard, too.
Wow.
I really appreciate you.
Yeah, we appreciate you guys, too, getting the word out.
Dr. John Hayes. And by the way, Al, if you want to talk, call or text Dr. John Hayes if maybe you want more information about how he could help you out. It's 781-659-7989, 781-659-7989. And you can find out more and read the blog at drjohnhayesjr.com. That's drjohnhayesjr.com. And Dr. John Hayes joins us in the house every Thursday at this time on WATD. Dr. John Hayes, as always, thank you so much.
Thank you, Rob. Thank you, Beth.
Thank you, Doctor.